So what is a pelvic health physio? What am I? So I'm a trained physiotherapist, but have further training in the pelvic floor and within the organs of the pelvis. So bladder, bowel, sexual organs, genitalia. So we're trained specifically to do internal assessments, vaginal or rectal assessments. So we're helping people with bladder, bowel problems, also pain generally in the kind of pelvic area. This is our specialty area. But as a musculoskeletal physio, we're thinking about the relationship with the whole body as well. So how it all integrates with specialty kind of knowledge in the pelvis. We are very privileged in that we do work with patients across a whole lot of medical specialists. So, for example, neurologists, gynecologists, and colorectal specialists, which is really interesting. So what is the pelvic floor? So it's a group of muscles. So it's referred to as a sling or a hammock, and it attaches at the front bone here at the pubic symphysis through to the back at the tailbone and into the side in your sitting bones. So both men and women have pelvic floor muscles. They're essential. The urethra and the rectum pass through the pelvic floor, and for women, we've also got the vagina passing through the pelvic floor. So now looking at a model of a pelvis, this is a female pelvis, the front of the pelvis and the back. So different to a men's pelvis in that it's lighter, it's wider through the brim here, it's got a round inlet and a larger outlet. So looking inside the basin of the pelvis here, we have our organs, we have our bladder at the front. This is our uterus with the fallopian tubes that would lead to the ovaries, and our rectum. So taking these out, we expose at the bottom that idea of a hammock connected from the front bones through to the tailbone and then the side, into the side wall too. And you can see the openings, the anus, the vagina, and the urethra. The pelvic floor muscles function as a support system. So they're literally supporting the abdominal contents above, including the bowel, the uterus, and the bladder. They're maintaining that bladder and bowel continence, and also for sexual function too. And as we'll talk about in another module, they're helping that postural stability and abdominal pressure, working with the diaphragm and the abdominal muscles too. The floor of the pelvis is made up of a layer of muscles. There's 14. This is the superficial, so we're looking up. I'd also like to just at this point highlight the sphincter muscles. Those are ring type muscles. They're almost like a closure on our exit points. So we have one for an anal sphincter and a urethra sphincter, and they work in conjunction with the pelvic floor to keep us continent. This is the internal or the deep pelvic floor muscles. This is what we're interested in as pelvic floor physios during pregnancy and postpartum with its strength to maintain continence. So this is the urethra, the vagina, and the anus. So this is the levator ani. So that's a group of 3 pelvic floor muscles that as pelvic health physios we're interested in. When we do a vaginal internal assessment, this is the muscle that we're palpating and we're checking the strength, the coordination and endurance. This is the muscle that has to stretch and potentially can be damaged in childbirth. So the pelvic floor system is a design that's made to be expandable and with contracting holes, but sometimes those muscles don't work well together, or they're weak, and they can be inefficient to closing the gap. I want to highlight also, it's not just the pelvic floor muscles, but within the pelvic bowl, there is fascia that also supports those organs. So ligaments and soft tissue are also helping the pelvic floor. Like any muscle in the body, the pelvic floor muscles can be trained with regular targeted exercise. So you can have pelvic floor weakness with an underactive pelvic floor, or that might be poor neuromuscular control, poor coordination. But also it can be an overactive pelvic floor, or also called a hypertonic pelvic floor. So that's the inability to relax, and it can cause muscle tension, spasms, and pain. So with an underactive pelvic floor, you can get incontinence of urine or feces. You can get increased urgency of urine, of going to the toilet. You can get pelvic floor prolapse that we'll talk a little bit more in detail later. You can also get a prolapse through the rectum, the anal system. And you can get pain and decreased sensation during sex. But also you can get multiple of disorders with an overactive pelvic floor, a pelvic floor that can't relax and it just holds tone in the muscles. So you have poor control of the pelvic floor, and it can impact your ability to fully empty the bladder or to have a good flow with urine. It can cause pain with emptying the bowels. You can have stress urine leakage, pelvic pain of lots of organs, including the urethra, the vagina, the penis, testes, the rectum, and the lower abdominal. It can be part of lower back pain or hip pain, can contribute to painful sex, erectile dysfunction or premature ejaculation, and it can cause things like hemorrhoids, rectal fissures and constipation. So what can pelvic health physios help with? Well, we can definitely help with incontinence. We can help with prolapses, and to the degree that we can stop them getting worse or trying to prevent them in the first place. We can help painful sex, bladder pain, difficulty emptying either the bladder or bowel, pelvic pain, including pelvic girdle or tailbone pain, coccyx pain, bowel dysfunction, including constipation, and then, of course, pregnancy and postpartum related issues, or issues related to prostate surgery too in men. So we have a pretty big toolkit, Primarily, pelvic floor muscle training is used, but also some of that can be kind of down regulating the pelvic floor, learning to relax. So it's part of that coordination. We educate quite a lot in regard to the anatomy around the pelvic floor so people understand what's going on. Lots of education about lifestyle. So we might be doing bladder diaries or setting up bowel or bladder routines. We're talking about we're talking about constipation management, toileting strategies, we touch upon things such as like diet and hydration, or refer them to a dietitian if we need more information or more guidance on that. We might give education about incontinence products. And also we just touch on, as any physio, kind of things like sleep and stress kind of management. Pain education can be a good one, a big one. And we might use things like TENS, there's tools like that. Relaxation techniques and breathing techniques can be important because it all relates to the pelvic floor. Sexual advice, also biofeedback can help in regard to pelvic floor training. And of course, exercise guidance, and then all those other tools that a general musculoskeletal physio would use. So that might be kind of myofascial release and things like that, and stretching.